All right, good morning and afternoon, everyone, depending on where you are, and welcome to today's Network for Public Health Law webinar, Federal and State Attacks on Vaccine Policy. We're so glad you could join us. Before we begin, just a few quick housekeeping notes. The presenter's slides and a recording of today's session will be posted on the network's website in about a week to 10 days. You'll receive an email with the link once they're available, along with a short post-webinar survey. We'd greatly appreciate if you could take a few minutes to share your feedback throughout the session using the Q&A function, and we'll do our best to address as many as we can during the discussion. And now I'd like to turn to our speakers. Our first presenter is Allison Winicky, Director of the Network for Public Health Law's Western Region team. Allison leads the region's strategic and sustainability planning, day-to-day operations, legal technical assistance, outreach efforts, and product development activities. She brings deep expertise in health policy, having drafted numerous pieces of federal and state legislation, as well as public health emergency preparedness and response, immunization law and policy, health information technology and telemedicine, and tobacco control. Following Allison, we'll hear from Dr. Dorit Rice, a professor of law at the James Edgar Hervey Chair and the James Edgar Hervey Chair in Litigation at UC Law San Francisco, formerly UC Hastings. She specializes in vaccines law and policy, including exemption laws and tort liability related to non-vaccination. She's published in law reviews, peer-reviewed journals, and blogs on legal and policy issues related to vaccines, and co-authored a book on vaccines, law, and policy with Professor Y. Tony Yang. And with that, I will hand things over to Allison to get us started.
All right, thank you so much, Nina. I'll start with a quick overview of what we're going to do today. If you could move to the next slide, please. There we go. So here's our roadmap for today. You know, things have been so busy in the last month with vaccines at the federal level, the state level, in the courts, in executive orders, regulations, everything. And so Dorit and I are going to hit all of the latest news that's been happening and its impact for public health. So first thing we're going to do, I'm going to talk about some of the NIH vaccine research litigation. Then we're going to move over to federal vaccine approvals and recommendations. So those are things coming out of the FDA and the CDC. Then we're going to talk about some important state litigation relating to vaccines and vaccine exemptions. And of course, we are going to leave some time for all the late breaking stuff that's just been happening in the last day or so, and have time for Q&A and discussion. So next slide, please. So I'm going to give a really quick introduction. If this is your first time joining us at the Network for Public Health Law, we're a nonprofit organization. We have a collection of the nation's best public health law experts in the country, and we provide assistance, technical assistance, policy briefs, anything that you might need. Next slide, please. And we cover every possible public health law topic. We have an expert on it, and we have an expert in your jurisdiction. So next slide, please. Please feel free to reach out to us to request assistance, sign up for our newsletters, check out our fact sheets and resources, and attend our events. Next slide, please. And I hope to see you at our public health law conference in just a couple weeks in Washington, in Seattle. But if events have conspired against your ability to travel this year, please put a hold on your calendar for September 2027, when we will hold our next biennial conference. All right, let's jump into NIH vaccine research litigation. There's been a lot of stuff happening in this area in the last couple of weeks. Next slide, please. So, the Supreme Court just issued a partial stay, about last week, 7 or 8 days ago, and on a case coming out of the First Circuit. and the District Court of Massachusetts. And so this is regarding a couple of cases that were filed for petitioners. One was like APHA and other nonprofit organizations. And then the second set, in the second related case, were a group of about 16 state governments who sued that their NIH contracts were canceled. And so what happened was, we had a lot of those executive orders and the DOJ related executive orders at the beginning of the year. And on February 28th, NIH issued some staff guidance in an effort to align with those executive orders that would completely excise all DEI related funding activities. And then, as I'm sure a lot of you know who work in public health and vaccines, on March 25th, NIH issued further guidance that would terminate grants that had terms that included the words China, DEI, transgender issues, vaccine hesitancy, and COVID-related research. And so, this was a lot of funding that was, in jeopardy. And so these two cases, they started in the Massachusetts District Court. They held a ruling to temporarily halt the federal government from cutting those funds. It went up to the First Circuit Court. They agreed with that. The Supreme Court just ruled on August 21st in a 5-4 decision that it stayed part of the district court's orders, and so what that means right now is they've kind of split it in two, and that it can go back to the circuit court to look at some of the APA issues, but the other part of the case, that's going to be dealt with the federal claims court part. And so right now, the NIH can stop funding those grants until it sort of continues to move through this process. And what we're going to see is that when it goes back to the First Circuit, plaintiffs' briefs are going to be due on October 16th. And so we'll start seeing some movement after that. And that phase 2 of the case, and that's going to go to trial in mid-September back down at the district court. So this is still moving, but it's something that the Supreme Court did weigh in on. Next slide, please. And if you haven't got a chance to read the Supreme Court decisions, there were several different concurrences and dissents, mixed in with each other. But I really wanted to highlight Justice Jackson's dissent, where she talked about Calvin Ball. And if you guys are familiar, like I am, with the old Calvin and Hobbes comic strip, she complained that these cases that are coming in before the courts are really like Calvin Ball, which only has one rule, that there are no rules. And she complained that the Supreme Court, they seem to have two rules, that there are no rules, and that the administration always wins. And so I thought that was an interesting dissent from Justice Jackson. Next slide, please. So, we talked about some of those NIH grant contracts where they kind of control F and looked for COVID or vaccine hesitancy and canceled those. Now we have another set of canceled contracts, and these come from BARDA. And so that's the Biomedical Advanced Research and Development Authority. And so they're really cutting the investments that we have done with mRNA vaccines. And so back in May, they canceled about $766 million in contracts with Moderna, where they were working to develop an H5N1 avian influenza, that's a bird flu pandemic vaccine. And so this is something they've been working on. It was, a really great investment trying to look forward toward the next pandemic. But now all of that has been completely canceled. That really puts us at a disadvantage when we're looking for ways to combat H5N1, which continues to spread and be an issue. And then just earlier this month, on August 5th, HHS terminated another 22 vaccine contracts that were for mRNA vaccines that amounted to about $500 million. And again, these were with various research institutions, other companies working in the space. And so all of those were canceled, and they also announced that no new mRNA projects will be funded. And so I just want to point out that, the federal government's been funding mRNA research for, the last quarter of a century. And that research was really instrumental in bringing the COVID pandemic to a close, with the creation of safe and effective vaccinations to halt the spread of disease. And so, we put in the money in the research. And so even at the basic step of just saying that we're no longer funding something that we've invested in that has given us such good returns, I think is a real mistake. And I also want to point out that this mRNA research is not just in use, or the potential use for infectious and emerging infectious diseases, is that scientists are looking for them as a way to treat cancer, diabetes, multiple sclerosis. And so this is also going to be stifling medical advances in other areas outside of the infectious and emerging infectious disease area. Next slide, please. Okay, so here is here's another one that this just came out on August 7th that I wanted to bring to your attention. So this is a new executive order, and it's entitled Improving Oversight of Federal Grant Making. Okay, well, let me tell you what this actually means. What this is doing is it's entrenching political oversight over scientific recommendations in the grant process. And so this new executive order requires that grants must be reviewed by senior political appointees. So they have to designate a senior political appointee to do this, and they have to ensure that all the grant call for applications that are put out, and the grants that are assessed and funded, that they demonstrably advance the president's policy priorities. So this is new, and this really is sort of entrenching this within the federal government. And the other thing that is notable is that, and new, is that this executive order prohibits these political appointees in this role from, you know, giving a check mark to just ratify or defer to any peer review recommendations from scientists and experts in the field. And so this is something that is very concerning for federal grant making going forward, is that their calls they're putting out and anything they're going to fund, it could go through this, scientific recommendations, but ultimately it's going to be a political decision and not a decision in the best interest of science. And I'll ask Dorit if you wanted to add anything on this, because I know you've been following these issues.
I think, in the interest of time, I think you covered the main points that I would make. So,
Okay, excellent. Well, I just wanted to give you the chance. Please jump in. Next slide, please. And I want to give you guys a resource if you are interested in executive orders. So the Network for Public Health Law, with our partners in the Public Health Law Partnership, have put out this FAQ on executive orders and specifically how they impact public health practice. And so there's a link there for you to check it out if you'd like more information about executive orders, because there's been a flurry, and I've never seen so many executive orders that have impacted public health. And so I assume there's a lot of interest there. Next slide, please. All right, now I am going to move forward and talk about what's been going on at the FDA and the CDC with federal vaccine approvals and recommendations. Next slide, please. All right, so a lot of you might know this, but I think that it's helpful as a refresher to talk about the federal agency roles. So both the FDA, the Food and Drug Administration, and the CDC, the Centers for Disease Control and Prevention, are underneath HHS, Health and Human Services, and that's headed up by the Secretary, Robert F. Kennedy Jr. So there's a head of FDA, a head of CDC, and they report to the Secretary. Now, both the FDA and CDC have really important but different roles related to vaccines. So the FDA, through their Center for Biologics Evaluation and Research, they do vaccine licensing and approval. And so this is where a pharmaceutical company, they go through the BLA process, the biologic license applications process, where they do clinical studies, they present their data to the FDA, and the FDA analyzes it with all of their scientists to then determine whether a vaccine will be approved for licensure in the United States. And there's a label on each vaccine. So based on the safety information that has come in through all of the rounds of clinical trials, they say who it's appropriate for, what are the risks, all of those things. So we have that. And the FDA, once a vaccine is licensed and approved for use in the United States, they have continuing processes with monitoring the safety and effectiveness of the vaccine, and they can, change their labeling and things as time goes on based on additional scientific information. So we have that FDA process. Now over to the CDC. So within the CDC, we've had for many, many years, the ACIP, the Advisory Committee on Immunization Practices. And this is, the top experts in vaccines, healthcare, folks who, this is really their top expertise area. They come together, they review all the evidence for risk populations, ages, and then provide recommendations on who should receive what vaccines. And, this is really important because the federal government, these are recommendations. They're not mandates, even though I know Secretary Kennedy has called them mandates before. And in the United States, they have the requirement and the responsibility to determine any vaccine requirements within their state. So say like school vaccine requirements and things like that. So these are recommendations. The state can either choose to, adopt CDC, ACIP recommendations. They can choose a higher standard or a lower standard. It's up to the state to do so. And so that's what the ACIP does. And so I have an asterisk here because I will note that on June 9th of this year, Secretary Kennedy actually fired all 17 ACIP members who have been serving on this expert committee for recommendation, and reconstituted the panel at that time with 7 appointees who have a documented history of anti-vaccine activism and skepticism. And so we're seeing this process where we have the fox guarding the hen house type of thing, where folks who don't necessarily have the expertise that we need to make evidence-based recommendations are making recommendations that the secretary then approves. So I'll say next slide, please. So now I'm going to talk a little bit about the FDA's COVID vaccine booster approval. So these just came out, was this yesterday? Time has just been flying so crazily with everything going on with vaccines. And so the FDA, all the different vaccine manufacturers, they've submitted their clinical trial information to the FDA for approval for these are the updated vaccine boosters. So where they tweak the formulation just a little bit, similar to like flu vaccines, to make sure they're trying to match up with the current strains that are circulating and are predicted to be circulating within this next year. And so there have been several changes that I definitely want to point out to you. And so the first change is that the FDA removed the emergency use authorizations from the COVID-19 vaccines. And so, and they're actually sending them back to start new clinical trials to get even more data besides the reams that have already been collected before and during the pandemic, to try to get them reapproved under the normal approval process. But what this means is that there are less COVID-19 vaccine boosters approved for use starting now for this 2025-26 season. And so there's another change as to the risk groups and ages that they're approved for. Before, and especially under the EUA authorizations, they were approved for everyone, basically. Now, the only group that is fully approved for label use under the vaccines are for adults who are ages 65 and older. So that stays the same. Everything else changes. So in the age group between ages 5 and 64, they're only approved for use if the individual also has a high-risk underlying medical condition. So this is different. Before, any adult could go get a COVID-19 booster because it was time to get a booster. Now they're approved only for also having a high risk underlying medical condition. And then the other category where things have changed a lot is in the young children. And so before, they had EUA approval for ages 6 months and above. Well, because the FDA removed the EUA for the Pfizer vaccine, now there's only one vaccine available for young children ages 6 months to 5 years, and that's the Moderna vaccine. And so there is some issue about availability of the vaccine, because there's just not as many options as there were prior to this time. And again, they have also changed it for the young kids as well, is that they also are approved only if they have an additional underlying high-risk medical condition. And one of the issues is that we're looking at is how willing doctors are going to be to offer that Moderna shot to young children off-label, what they call, so that it doesn't exactly align that they also have an underlying medical condition, and whether insurers will continue to pay for those immunizations if the individual doesn't have one of those additional underlying medical conditions. Next slide, please. So now we're going to move into talking about the CDC ACIP vaccine recommendation changes. And so they had an ACIP meeting several weeks ago, and they had another one in April, and so they've changed some of the things. So the big thing is to note is that for the influenza vaccine, ACIP recommended only thimerosal-free influenza vaccines. That's a change. I will say it probably won't have that much of a practical effect, because about 96% of our flu vaccines are, thimerosal-free syringes. And so that might not have a big change. They've also, earlier in April, removed the COVID-19 vaccine recommendation during pregnancy. And they also, as of today, there are no COVID-19 vaccine recommendations for the 2025-2026 series. So any of those vaccine recommendations from ACIP, those apply to last year's vaccines. And so what we're waiting on now is to see if they are going to come out with any vaccine recommendations, or if they will not recommend COVID-19 vaccines for anyone. And so, as I said, this is a recommendation, right? I mentioned that earlier. But so why is this a big issue? Well, the issue has to do with access and affordability. And so, since its inception, ACIP recommendations were considered the gold standard in evidence-based scientific recommendations. And so, health insurers, both public and private, other government programs, they pay for ACIP recommended vaccines, and they usually don't pay for vaccines that aren't ACIP recommendations. And so, what we're looking at here are a couple issues. People who are going to be most cost sensitive will go unvaccinated. And, this is really going to impact people who it really does make a difference if they have to pay, that copay, or the full price for a vaccine is definitely not cheap. And so, vulnerable communities, at-risk communities, this is something that's going to definitely be an issue for them. And, I'm really worried about increases in vaccine preventable diseases if we're not getting, cost sharing coverage with vaccines that previously were ACIP recommended and now are not. Now, the other issue is about supply and demand. So if there's less demand for the vaccines because of cost issues and coverage issues, well, it makes sense that less vaccines would be produced. And so there's another issue, is that we can also have vaccine shortages in the future. And so this is definitely something where these recommendations have essentially restricted our access to life-saving preventive tools for Americans, putting our entire population at risk, and our most vulnerable as well. And, going back to the recommendations for ACIP, for the FDA approval vaccine recommendations with children and underlying conditions. We've got whole new population groups growing up that they haven't necessarily been exposed to COVID-19 without that immunity, and then they're not getting the opportunity to get vaccinated as well. And then next slide, please. So here's some good news. I actually have some evidence-based vaccine recommendations that you can check out as an alternative to the ACIP recommendations that no longer appear to be evidence-based. So the Network for Public Health Law is a member of the Common Health Coalition, working together with public health and healthcare providers to improve the public's health. So they have some great resources, and there's a link here to access them, where they are compiling together in one space all of the professional associations, medical associations, vaccine recommendations. And there's also the Vaccine Integrity Project that is putting together, they have had meetings where they're trying to sort of replicate some of the work that ACIP has done, reviewing, scientific information to make recommendations. You have the AAP, American Academy of Family Physicians, the ACP, the American College of Obstetricians and Gynecologists, and the Society for Maternal and Fetal Medicine. They have all put out their own vaccine recommendations for their providers and their patients to try to maintain the levels of vaccinations needed to make sure that our populations stay healthy. And now I'm going to turn it over to Dorit to talk about some of the things that have been going on with ACIP recommendations and political issues, and fill us in on all the latest.
So I'm going to start with a follow-up on where Alison ended, which is we have now conflicting recommendation between AAP and ACOG, the American College of Obstetrician and Gynecologists, on vaccines, especially around COVID-19 vaccines. And I want to follow up on Alison's wonderful presentation by starting with availability, insurance, and liability. And I'll bring into what Kennedy said about that. First, Alison highlighted the practical problems about the availability, and she rightly pointed out that you don't need recommendation for it to be legal to get the vaccine. As a reminder, it's legal for doctors to give a vaccine off-label. There are several important vaccine recommendations that were off-label when they started, such as Tdap in pregnancy, for example. So it's legal to give the vaccines off-label, but there may be concerns about availability. And again, to highlight the point Alison made, the connection between recommendations and insurers is that under the Affordable Care Act, insurers have to cover vaccines that are recommended by ACIP, but don't have to cover vaccines that are not. And here I want to qualify something Alison said, which is before the ACA, insurers vary. Some covered it, some didn't. And I don't know what they'll do now. At least some private insurance, I expect, will cover the vaccines, whatever ACIP does. However, Medicaid, so Medicare has its own provision about COVID-19 vaccine and influenza vaccine. Medicaid will be covering them. And they're also the 65 and up that are covered by, that are under the FDA label. But Medicaid is a federal program and it is going to be bound by ACIP vaccine. So going back to Alison's point, access may be hardest for those least able to afford lack of private coverage, because Medicaid will not cover if ACIP makes a different recommendation. I don't know when that'll be, because right now there's no ACIP meeting scheduled. I mean, except in September, before October, and late October is a little late here. The issue I wanted to add is Secretary Kennedy is not particularly happy about AAP recommendations, and he targeted them in a post on X, formerly Twitter, saying two things: attacking them, claiming conflict of interests, because some of the money for AAP comes from pharmaceutical companies, and in the screenshot he did that, he expressly cut the non-profit organizations that support AAP, and he warned about that they may be subject to liability if they ignore a SIP recommendation. And that's where I want to pick up. By the way, I've heard that the 2025-2026 formula is already being shipped out. So it will be available before anything ACIP does. Whether the recommendation comes from ACIP or AAP makes no difference to liability for COVID-19 vaccines. I'll talk about childhood vaccine in a moment. Why not? COVID-19 vaccines are under the PrEP Act declaration. In 2020, the Secretary of Health and Human Services issued the first declaration that said manufacturers and administrators of pandemic-related countermeasures, including vaccines, are protected from liability unless there's willful misconduct. That declaration is still in force until 2029. Just be aware, the Secretary can cancel it, but hasn't moved on that yet. I don't know why. So, right now, administrators of COVID-19 vaccines are immune from liability. And that's true for doctors. I'll talk about pharmacists in a moment, whether or not they're following ACIP recommendations. So doctors giving ACIP, giving COVID-19 vaccines according to AAP recommendations are not going to be liable, because that's not willful misconduct. It's defined very narrowly in the Act, and that's not willful misconduct. So there's still no liability, and Secretary Kennedy was inaccurate in what he said. However, first of all, pharmacists under the PrEP declaration are only immune from liability for vaccines they give under ACIP recommendations. So pharmacists may be concerned about liability. That's one. And in fact, I understand that in some states, pharmacists' authority to give vaccine is tied to ACIP. So they may not be able to give COVID vaccines if ACIP goes the other way, and we don't know what ACIP will do yet. Second, doctors might not understand this. So doctors may think they're going to be liable if they ignore ACIP recommendations or if they ignore the FDA label, which isn't true. And they might hesitate to give COVID-19 vaccine for that reason, again, creating an access barrier. So we're going to have concerns about liability leading this. For childhood vaccines, right now, COVID-19 vaccines aren't under the usual the vaccine compensation injury program that's for childhood vaccine. But those vaccines generally aren't the program when they're recommended by ACIP. So one thing that might happen in the future, but hasn't happened yet, is that ACIP will unrecommend certain vaccines for children, and the secretary will then remove those vaccines for the vaccine injury compensation program and send them to the courts, and their liability concerns will rise again for manufacturers and for administrators. So we have concerns about liability, but they're not directly about COVID-19 vaccines right now until the secretary moves on this. So that's about this. Next slide. I know we have limited time and we already covered a lot, but I want to say something about religious exemptions because that's another area we're seeing battles that are going to affect the public health. As a reminder, in all states, right now, a school immunization requirement is the main way to keep childhood vaccine rates high. And most states, but not all, have religious exemptions. There are battles going on in all the states that don't offer religious exemption, and I want to highlight two of them because they're in interesting stages. One is West Virginia. West Virginia never had a religious exemption. Pretty much since the start, opponents have tried to add a religious exemption, and the legislature rejected it. I think 2023, a bill passed through both houses adding a religious exemption, but the governor vetoed it. When Governor Morrissey, the current governor, came in, one of the first things he did is issue an executive order creating a religious exemption. The legislator was looking at a bill to add a religious exemption, but that bill actually failed. So where we are now is that the statute doesn't have a religious exemption, but the governor's executive order does have one. And you won't be surprised to know there's litigation from both sides. Litigation is saying and the governor actually joined one of these cases. The First Amendment requires a religious exemption, you have to add it. And litigation saying the legislature didn't add a religious exemption, so governor, you can't add that. The cases have been consolidated and they're still in the process right now. So there's two battles here. One is that battle in the court. The other is a political battle where the governor is trying to pressure both the legislature to add the religious exemption, because the legislature can't do that, and the school boards to accept his executive order and add the religious exemption. And here again, Secretary Kennedy stepped in. And by the way, one of the developments we're seeing that we should all be concerned about is Secretary Kennedy has actively used his influence in, as far as I know so far, only in red states, to support and promote anti-vaccine legislation. He came in Idaho, he came in Texas, and now the Department of Health and Human Services issued a letter to West Virginia threatening them with removal of their vaccine for children funding if they don't add a religious exemption. That letter is problematic in several ways. One, it tries to interpret West Virginia law for the locals. The federal government doesn't have that authority. Second, it addresses, uses the Vaccine for Children program to address school immunization, two separate things. And third, HHS does have authority to protect conscious freedom, religious freedom of healthcare workers, but nobody else. And here they're not protecting conscious freedom of healthcare workers. But Secretary Kennedy is ignoring that and is trying to put pressure on West Virginia to add a religious exemption. My suspicion, and I have no evidence for this, is that there might be collusion here, that he's helping the governor by exerting pressure to push the legislature and school boards to cave and add a religious exemption. I don't think HHS thinks that they can actually do anything practical with this, but it shows you that the federal government is putting its clout behind anti-vaccine efforts in the states as well. And we don't know what will happen in West Virginia. There's several ways this could end with this state that never had a religious exemption, adding a religious exemption. The other place I want to talk about is California. California was the first state in the new trends to remove religious exemption in the late 2010s. It was followed by New York, Maine, and Connecticut. Maine and New York together in 2019 and Connecticut in 2021. And it's been challenged in the courts before, but in 2020, the Supreme Court changed its religious freedom jurisprudence to make it harder to deny religious exemption. So there's new litigation in California as well. In one case, Royce versus Bontas, in all three cases in California, even in the new round, lower courts have denied the challenges, said California does not have to have a religious exemption. One of them, Royce versus Bonta, is currently before the Ninth Circuit, and we don't know which way that's going to go. It's still open. But I want to emphasize that I can go into the legal arguments if you ask me. I'm intentionally keeping this super short without giving you enough explanation. But the main issue here is opponents are claiming if you have a medical exemption or if you have any other secular exemptions, you have to also have a religious exemption. Courts in California have rejected it. One court in Mississippi has accepted it. So this is an area where we have pushback from both directions, and we don't know how it'll end. It will likely eventually end in front of the Supreme Court. I hope not for a while, because I just don't know which way the Supreme Court will go. The current Supreme Court may or may not find a need for a religious exemption from the school vaccine mandate. There are clearly three Supreme Court justices who think we should add a religious exemption. That's Justices Alito, Gorsuch, and Thomas. There are clearly four votes against this. Chief Justice Roberts and Justices Sotomayor, Kagan, and Jackson. But we just don't know which way Justices Kavanaugh and Barrett will go. They gave conflicting signals in the past. So if it gets to the Supreme Court, it could go either way. And I don't think that we want to trust that. So be aware that religious exemption to vaccine requirements may be at some point constitutionally required. And as part of this jurisprudence, courts have also made it harder to refuse religious exemption. So they may be weakening our school immunization requirement by making religious exemption easy to get and required. Do you want me to talk about the CDC firing, or do you want to talk about them, Allison?
Well, before we get to the latest employment issues at the CDC, I did want to ask you quickly if you could elaborate a little bit more on what you mentioned about the friendly lawsuits and the possible collusion, because we've also seen some friendly lawsuits against Secretary Kennedy from his own anti-vaccine nonprofit. And your example of kind of working with some of these states to have the states push through anti-vaccine legislation using their bully pulpit, I'd love to hear your thoughts on that a little bit more, because it is something new and interesting.
I think we're seeing quite a bit of litigation that Secretary Kennedy is using for his benefits. And you correctly mentioned that his organization has brought has brought two lawsuits that seem to be to let Secretary Kennedy do things that he already wants to do. One of them was a lawsuit demanding that he reestablish a task force that was created in the 1980s under the National Childhood Vaccine Injury Act. And he actually did that. He settled that lawsuit by caving. And the other is a lawsuit that asked him to add COVID-19 vaccine to VICP. And I think that one is getting pushback. But we are seeing the federal government and inserting itself to state issues, and anti-vaccine organization bringing friendly lawsuits that seems to be colluding with, in West Virginia, with the governor and at the federal level with the secretary in pushing an anti-vaccine agenda, kind of a two-pronged battle where the political leaders are being supported by lawsuits that push them where they want to go.
Yeah, absolutely. That's definitely something to highlight for folks. Next slide, please. Okay, so now we're going to pivot to some of the late breaking issues that are happening and hopefully get in a little bit of Q&A. Next slide, please. So if anybody's keeping track, this is, this ongoing list of folks who have been pushed out or forced to resign from CDC leadership in what, the last 48 hours or so. What is going on, Dory, with all this? And is anyone left at CDC?
So first of all, there's a lot of people left in CDC. So this is a little bit of a developing story. So I'm a little nervous that what I say will turn out to be wrong tomorrow. But just so far, here's what we're understanding. Um, Secretary Kennedy has quickly become unhappy with Dr. Menarez, and he's been apparently pressuring her on two things: on accepting ACIP recommendation against vaccines and on firing a whole range of leaders. So either yesterday or the day before, he called her in and told her that she's essentially fired. And apparently, there was also a notification from the White House. Dr. Menarez has hired lawyers, and her position is that since she's a political appointee nominated by the president and confirmed by the Senate, only the president himself can fire her. That's true as a matter of legal, that's true legally, but the president can fire her at will. So unless the president objects, that might change quickly. But what she did by doing that, and in a moment I'll talk about the other firing, is it really, I think, made this a lot more visible and highlighted just Secretary Kennedy's actions and forced this to the president's attention, because I'm not sure the president was involved in the earlier part of it. Be aware she may be suing, but if the president steps in and says she's fired, there is no legal claim that will kill that suit. As far as I know, the president hasn't done so yet, which is why I'm saying this is a developing story. In sympathy, multiple high-level officials in the CDC resigned, and several of them wrote very strong resignation letters. So what's I want to add one more legal thing here, which is next step. What's happening next, assuming that the president does? If the president says, I'm not firing Dr. Monarez, she's back in office and there's question, and she's in CDC. If the president fires Dr. Monarez, there's two options. Option one, the president will nominate someone else that will go to the Senate. That'll take a while. So option two might be whether or not the president does it, which is to appoint an acting director. Who can be an acting director? The first assistant to the director, or someone who's Senate confirmed in another position. So yes, the president can put in that, the president has to do it. The president can put in that position, for example, Dr. Makary from FDA or Dr. Bhattacharya from NIH, or anyone else that's Senate confirmed, or someone who's been in the agency at least 90 days at a senior position. So they have options. How about the other people? So I think these other people would have been fired if they didn't resign, and resigning in this manner and making statements has a lot of benefits. But Kennedy can now appoint people to those positions without any oversight. He does not need Senate confirmation for that. So there's a question. Someone just posted in the chat that there's an AC meeting scheduled. So keep that in mind as well. We'll see what they do.
Yeah, I mean, it's important to point out that, with this, fire raging through CDC leadership this week, that we're losing decades and
Yes.
decades of expertise. These folks are some of the best experts in the country. They have worked there through all types of administrations, for different secretaries, different political appointees. And so this is a real great loss for the CDC and for our country, because
Yes.
this is creating a real vacuum of expertise. And, I'll even point out, back to the earlier DOGE executive orders this year of just trimming the federal government and all of the staff reductions that we've already seen at HHS and CDC, and the now smaller contingent, and now losing their leadership like this, this it puts that the organization that protects the public's health in a really precarious position as we're going into the new respiratory infectious disease season that's starting up this fall. And so this is definitely something to watch. And then I'll go back to what we talked about that executive order for grant oversight, really trying to embed political appointees into the funding process. And here's an example where you're seeing long-term government civil servants leaving because of political pressures. And that's something that worries me so much, is that we're losing that scientific expertise, and it's being replaced by political whims, and that's not good for public health in the least.
Agreed. The only thing I would add to what you said, and I think you're exactly right, is um, there's losing these people. Among other things, one of the things that I understand for people in the CDC was going on is that their heads were acting to some degree as a buffer between them and the administration. So the loss of the head, as you're saying, it's a loss of expertise, a lot of people qualified to managing issues. But I think we're going to also lose staff that no longer has this buffer to protect them from what they're seeing going on. And for example, one of the things that might have led to this is in the first AC meeting, CDC staff did excellent professional presentations. I think without a buffer and without protection, we might not see that anymore.
Yeah, absolutely. And
Can I
so
say something about the question here about the AP suit? There'll be a hearing about the lawsuit in the second week of September. So look out for that. That lawsuit is still going, and they're going to have their oral hearing on I think 12th of September, but it might be a day or two before that.
yeah, and that's a good point. I didn't list that on our slide, but that is for the American Academy of Pediatricians suing the HHS secretary related to ACIP recommendations. And
Mhm.
so that's another important case
Yes.
that we're following in this area. We have a little bit time for questions, and I see a few of them in the Q&A. And so I'm gonna take one of them. And so this is talking about kind of a divide. We talked about federal issues and state issues. And so, if we're seeing a federal vacuum of where we normally would have that gold standard, that expertise, now things are, really falling back on the states to make decisions. And as you spoke about, Dorit, some of these sort of like friendly pressure or collusion even with the federal government and the states to try to move through some of these issues. And so this question talks about during the pandemic how we really look to state and local health departments to direct the response and with this sort of coordination from the CDC at the federal government. And so their concern is, will we start seeing a difference between so-called red states and blue states regarding, vaccine recommendations, requirements, safety issues? And then we talked about these sort of alternative ACIP recommendations by the professional medical associations. And where do they play in with this? Because now instead of the CDC really leading the way, it's kind of devolving into a patchwork.
I mean, I think you're exactly catching part of the problem. We're going through the wrong way to have a natural experiment.
Yeah, I mean, that's something that, we could see. I mean, if this really plays out, where we're talking about reduced access to vaccines and vaccine shortages and states kind of putting up money to maybe bring vaccines into their state versus states that aren't going to put up money to provide vaccines for their, we could, it's not inconceivable to see, increases in vaccine preventable diseases in some states as a result of their actions, and in other states. But as I always say, disease doesn't know any political border, right? And so people are going to cross borders, people are going to move. And so that's something that I'm definitely watching to see how that plays out, because we're in a new paradigm now that we haven't been in any of our lifetimes. All right, let's see. Do we have any other questions in the chat, or is there anything else we
In the
want to cover?
Q&A, we have a number of questions.
Oh, let's see. Oh, so one of the questions talks about the where do we go for the best data-driven vaccine information? Where do the CDC ACIP recommendations lie in that as a, a credible source? And what about international groups? I mean, the CDC has really led the world in having experts in infectious disease and vaccine preventable diseases. Is another country going to step up and try and fill that void?
And also a reminder that the World Health Organization, for the question of resources, so you gave a number of national resources, and I think those still stand. But I want to remind everyone that the World Health Organization has a site that's called the Vaccine Safety Net, where they list credible vaccine sites that they vet from all around the world. There are several US sites. The Vaccine Education Center in the Children's Hospital of Philadelphia is on there, as are some others. But there are also sites from all around the world. That doesn't answer the question of, will another country take the lead? I expect other countries will take the lead, both on research, by the way. If we think other countries won't take advantage of our limits on research and won't offer home to scientists, why wouldn't they?
Yeah, I know. Our loss and their gain. And pointing out the World Health Organization, WHO, I also just want to point out, on his first day of office, President Trump issued an executive order to again withdraw the United States from the World Health Organization. So that order is out there. It is a 1-year process, so we're like technically still in it. But that's another thing, is sort of just an example of us, abdicating that space, that leadership space in this area that we've held for so long. Well, I know we are about out of time. I'm trying to look.
Can someone create a list of the questions and maybe we can answer at least some of them?
Yes, we can absolutely do that. So I will move to next slide, please, if that's possible. And thank you guys for attending. And Nina, you want me to turn it over to you to close it out?
Yes, thank you all so much, and to Allison and Dorit for sharing your expertise with us today. As a reminder, the recording and slides will be posted on the network's website within the next 7 to 10 days, and you'll receive an email once they're available. Please take a moment to complete the post-webinar survey when it arrives in your inbox. Your feedback helps us continue to provide useful and relevant programming. And on behalf of the Network for Public Health Law, we appreciate your time and participation, and we hope to see you at a future webinar or at our Public Health Law conference in September. Have a wonderful day.